Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dawn from Soteria Wellness Holistic Therapies. We learned so much from Dawn in our 4 episodes together, including tips for prioritizing self-care and the power of massage therapy in episode 1, the surprising benefits of bodywork for kids of all ages, including special needs, in episode 2. Then in episode 3, we talk about how much breast health matters, and she gives some expert tips for cancer prevention. And then in part 4, we talk about exploring holistic therapies by thinking outside the box, maybe some therapies that you haven't heard before. These were all amazing and very, very insightful discussions. But a little bit about Dawn. She is a national board certified and Wisconsin licensed massage and bodywork therapist who holds advanced certifications as a craniosacral therapy diplomat. She's a prenatal, postpartum, and infant massage therapist, an advanced metacupping practitioner, a LymphStar technician, and a level 4 touch for healing specialized kinesiology practitioner. Woo! She is incredibly smart. She has so many certifications, and she really knows what she's talking about. She is also an internationally accredited emotional freedom technique, or EFT practitioner, and a certified essential emotions coach. Dawn began her journey working with parents and babies as a home daycare provider, natural childbirth teacher, La Leche League leader, and doula while homeschooling her 3 children. I would say superwoman right there. In 2009, after seeing the profound pain relief that craniosacral therapy brought her mom, she began her journey into the world of bodywork and massage therapy with an early emphasis on working with growing families. Soteria's motto is enhancing optimal health throughout the lifespan, and Dawn loves working with all ages, from infants to elders. She loves to empower individuals and families with tools for natural wellness and truly believes in the body's innate ability to heal itself when given the right support. When Dawn is not in the office, she enjoys practicing what she preaches about self-care, receiving regular body work, reading, spending an abundance of time in nature, and hanging out with friends and her 3 adult children and their partners. All right, we can't wait for you to learn from Dawn, so let's dive into today's episode.
Hey, welcome back to the podcast. This is Drea and Brittany here with Dawn from Soteria Health and Wellness. We're super excited that you're here today again. We had some great conversations regarding self-care, talking about massage and body work and pediatrics in the previous episodes. And this one, we're going to be talking about breast health, which is something that I feel like not a lot of women really want to talk about. Like, it's kind of like, they're there. Sure, I'll do my checks. Maybe I say I do. I don't know if, I hope that people are doing their self-checks. But Dawn is an expert in breast health and taking care of ourselves in that way. So, first of all, like, what is the most important aspect of breast health? Like, we talked about the lymphatic system before. And you can, if there's something more important about breast health, I guess, but let's talk about the lymphatic system. Let's talk about like how that intertwines with our breasts.
That is a great place to start when we're talking about breast health. My training actually, more specifically around breast health, was at the Sperlin Institute of Breast and Lymphatic Health for a reason, because they are so intertwined. And when we think about our breasts and breast tissue itself, we need movement and muscles to move lymph. And our breast tissue does not have muscles. We have our chest wall, we have our pecs. But if we're not moving our breasts in some way, that lymphatic fluid is not moving. When our lymphatic fluid is not moving and it's stagnant, we can develop, swollen lymph nodes anywhere in the body, including the breast. We can inhibit the removal of foreign substances that we don't want accumulating in breast tissue. And our lymphatic system isn't like our circulatory system that's pumped by our heart. Those vessels move alongside the circulatory system, blood vessels, but it does not have a pump. We have to be the pump through movement, whether that's exercise, and doing toe raises to move our calf muscles for the lower part of our body, or getting on a rebounder or a vibration plate or something like that, or bouncing on an exercise ball, can all help stimulate overall lymphatic movement. But our breasts need some extra care and attention, especially because in our society, most of us keep them pretty tightly holstered most of the day. And they're not getting the movement. And we're not necessarily touching our own breasts. You said, hopefully
Kind of
we're
voodoo,
doing that.
yeah.
It really is. It's kind of like we just ignore that part of our body, other than, when we're feeding a baby and there's problems, then we might pay attention. And I think it's something that, wouldn't it be amazing if even our teenage girls we could take some of the taboo off of talking about breast health from a young age, so they know what to be aware of. And so it's not a big, scary thing that moving the lymph and touching the breast becomes a normal part of that self-care that we talked about, right, in the first session. And, part of actually a small daily habit. It takes a lot of the fear factor out of, once a month I'm going to feel around, and what if I feel something? You start to learn what's normal for you if you are regularly touching your own breasts.
So when you say the breasts need help with lymphatic movement, what are your top ways to do that? Are you talking about like a breast massage? Are you talking about going braless? What are your recommendations?
So yeah, lots of things we can do. Allowing the girls to move is huge. So, it's like if you are in a situation where you feel, I need to be wearing a bra, at least avoiding underwires if you can be a great step in the right direction, because it's going to allow for better movement and flow and not putting pressure along all of those lymph nodes going up into the axillary, the armpit area. And, even thinking about the fabric of what's on your breast, breast tissue, because there's kind of that denser breast tissue and there's fatty tissue. Fat in our body holds on to toxins. And so if we're using, if the fabric that's on our breast for how many hours a day is both restricting lymphatic flow and potentially introducing, formaldehyde and other toxic chemicals that's regularly found in fabric into that very sensitive, receptive area of the body, over years and years and years, is that part of the reason why maybe we hear these 1 in 8 statistics about women, getting breast cancer sometime in their life?
Yeah, and I actually have a statistic here. You're looping that right in. So we have the same stat, but I have, according to American Cancer Society, breast cancer accounts for 30% of all cancers among women, and 1 in 8 women will develop breast cancer sometime in her life. So, but in the 1970s, it was 1 in 10 women, which may not sound like a huge difference, but that is a huge difference when you look at the population. So why do you think the rates have been rising in breast cancer, and are there things we can do at home to help prevent it?
I think part of the rates rising is in the last 50 years. The chemicals that are used in agriculture, in cleaning, in our clothing, that are just surrounding us, they bioaccumulate, especially in people depending on their genetic makeup. They may have issues detoxifying the way somebody that does not have that genetic makeup might. And if we're not supporting our bodies, not supporting our lymphatic system in clearing those toxins out of our bodies, and we're also dealing with more and more and more exposure as the years go on, um, some aspects of progress come with some pretty big downsides. And I think there's a certain level that's within our control. And there are some things that we can't control. And that's where some of that self-care on a regular basis at home comes into play. So what are some of those controllables? Well, what are we putting in our body? The food we eat, the water we drink, not drinking out of plastic water bottles, and drinking out of glass or stainless steel. Simple little tweaks that we can make that can help, not heating food or storing food in plastics as women can be a very important thing because of the endocrine disrupting hormones that are released from those plastics. Even thinking about kiddos and baby bottles and what are they made of, right? So, we look at a cumulative lifetime exposure, and then if we're not also supporting our body and eliminating this excess, that becomes a big problem. I love, resources like Environmental Working Group that you can go on and kind of get a read on like levels of pesticides in common fruits and vegetables. It's like most of us can't afford to go out and buy everything all organic. Let's be real. But maybe I can look at that and say, ooh, okay, if I'm going to be buying strawberries, I'm going to get those organic or I'll get something different. And we can make those small decisions that can really help over time. What goes on your body? What's in your shampoo? What's in your body wash or your soap? What's in your cosmetics? And look at some of those ingredients. Our skin is almost like another mouth. It's another route into our body. So if you wouldn't eat that, is that something you really want to be putting on your skin on a daily or multiple times a day basis?
That's a great question, a great perspective.
And I really love that you brought up the Environmental Working Group. They have an app too that you can download and you can put in common, shampoo or whatever, and you can see kind of like a rating scale. So that's a great point, or, that's a great starting point too, because all of this can be really overwhelming for somebody. They might be like, I cannot just get rid of my entire pantry and everything else and start investing in this, right? So even just little things at a time can make a big difference over time,
For
and
sure.
the more you do something, the easier it becomes.
Yeah. And I'm gonna just go ahead and say that we could end this podcast right now and I'm walking away learning a lot. I mean, everything that you just said of, I think people in today's age, anyone who's health conscious is thinking about, they've probably heard that plastics are not good, and they've kind of heard about, I should be checking my household cleaners
and
and
is it worth
things
it?
like that. But then when you bring in the piece of like our breasts are not moving, and so we're collecting these toxins and they sit there basically for years and years and years, that is the perfect storm.
It really is.
So, I mean, you've already enlightened, I think, all of these listeners to be like, there is something I can do to help decrease my chances just by giving myself, we're going back to self-care, that tiny bit of self-care of taking care of our breasts. Wow. One question that I do have is, does a history of breastfeeding or not breastfeeding, so if you've ever lactated in your life, how does that affect the breasts when it goes to breast health going forward?
There are quite a few studies that do show a reduction in risk, especially if cumulatively you've hit, I believe it's at least a year. I haven't looked at the stats recently. So, whether that's, a couple months for a bunch of kids or whether that's, one baby that nursed for a year. So, definitely some benefits there. I think, our breasts have that capability and function, for a reason. So I'm not surprised that there are long-term protective benefits to using them that way, when that's possible.
Yeah. Okay. That's great. Now, if a woman is doing a breast massage, and she feels a lump or something she's concerned about, what should she do?
So lumps can be from a number of different reasons. Many, many, many women have dense breast tissue and their tissue is going to feel lumpy. So, of course, if you have, questions and need some peace of mind, talk to somebody. But I think it's very important to learn what is your normal. Because if you have lumpy, dense breast tissue, it's not necessarily a cause for alarm. And what I find is that women who are regularly doing home breast massage, as I teach them, a lot of times that density will start to decrease where it'll even show up differently. If you are doing a mammogram or an ultrasound over time, that density might start to go down and it might become more mixed because you're getting out some of those areas that have just gotten kind of stagnant.
Even if you are not currently breastfeeding, does breast tissue change with our menstrual cycles?
Absolutely. It changes with menstrual cycles. It changes again in menopause. So that's part of the beauty of what we teach isn't doing a monthly breast exam, but actually doing daily breast massage. And you can do it in the shower and just take a little bit of time. But if you're doing that, you're feeling what's normal for you throughout your cycle. And you can feel those changes and recognize that over a period of months of, oh, okay, this is how my breasts are this week, and this is how they are this week, and this is how they are now. One of the benefits we see too is a lot of times, a lot of women at certain times in their cycle will deal with a lot of breast tenderness. And with regular breast massage, a lot of times that'll really become minimal. And the breast will become much less tender because they're starting to get used to being touched that way. And they haven't been.
Yeah, that makes sense.
So you have actual education classes for breast health. And I love that you brought up too, you love having young girls learning about this earlier too. And I know we've talked about this before, previously, and it's how you really recommend that moms and their daughters come into these classes. Can you talk about a bit more about your classes? How often are they held? A little bit more about them.
Sure. I did have a little bit of a pause, but have been getting back into more of our classes and events again. And most recently, it was really neat. I was able to do a collaborative class with Dr. Lindsay Seafelt and Natalie Green, who's a breast cancer survivor and coach. And it was a great class and a very fun collaborative session. And we all each kind of focused a little bit differently. And that one was targeted more to, women dealing with breast cancer. In my solo classes, I'm taking more of a preventative stance typically. And so I hadn't thought initially about, this would be a great thing to, have these teen girls at until I had a couple of moms bring them. And it's like, and they looked absolutely horrified to be there.
I can just imagine for myself, my mom dragging me in there. Oh my gosh, at 15 or whatever, horrified.
Yeah. Oh yeah. Those 15, 16-year-olds, great time to bring them in.
Yes.
To one of these classes and to start educating them, and encouraging them that maybe they really don't want to live in those underwire bras for their whole life, and things like that. And it's really neat though, because without fail, every time that one of those teenage girls is in there, they might not ask questions in class, but a lot of times they'll come up afterwards and they'll ask me a question or even just say, okay, I thought this was going to be so lame, but I really learned a lot.
That's awesome.
It's
amazing.
So it's really, one of those things that's been stirring my passion where it's okay, how do I start reaching out? And maybe what I need to do is do a mom-daughter specific breast health class.
I think that would be great.
Really
you absolutely should.
Because I think it's also hard for moms, even if they are doing regular breast exams, it's hard for them to talk to their girls sometimes, obviously, depending on the relationship. You hope you have that close of a relationship, but it can feel awkward, some of those birds and bees, and you're hitting puberty talks. And so to hear from someone else, I mean, I have a daughter, and I think when she's hold enough. I think that would be really helpful as for me to be like, okay, not only do I not have to do the heavy lifting on the education portion, but I can take her and truly get expert advice and then we can discuss it.
Yeah. Like having a daughter mom like date, basically. Like that's awesome. I know with me, I would have been like just our mom. I just can't even imagine that doing that. But if I was like, we're going to this and some expert was teaching on this, oh heck yeah, I'd listen to you. I wouldn't, my mom, no.
At the time,
absolutely
I don't want to
not.
talk about that.
We are not talking about this, Mom. Oh
Yeah.
my gosh, but yes, absolutely.
So what types of therapies do you do in your office when it comes to breast health? So what are people coming to you for, or what are some therapies that maybe help us think outside the box on ways that you can support breast health?
Some of the women that are coming in are already somewhat aware of issues going on, whether, because of, medical testing or diagnosis, or maybe they're on the other side of breast cancer and they've had extensive surgery and there's a lot of scar tissue that's causing restrictions in movements and pain and limitations and, lymphatic congestion. So I'm really working across the spectrum there. If somebody's in acute care, I'm more likely to refer them, to PT at least for a time. That's kind of breast focused. But some of the preventative side of things and the education side of things, and then some of that ongoing aftercare. When we're talking about breast congestion and pain and issues and, lumps of different sorts and things like that too. Sometimes we need to think a little bit out of the box and start looking globally at what's going on posturally. How many of us through years and years of raising our children, we have forward head posture, we have rolled forward shoulders. That in itself is going to be blocking lymphatic flow to our breasts. So sometimes people come in for a session and they're starting, face down on the massage table so that I can use, some metacupping or whatever to open up their rib cage and get their shoulder blades moving, and then give them a couple of tips on how can we bring those shoulders back in a relaxed, non-stressed position as we go about our daily life, so that what you're doing with the breast massage that I'm teaching you is going to have some benefit. So we really, the body's connected. So yes, there's the breast focus, and we're looking at everything through that. We're looking at, do you have congested lymph nodes behind your ears? Right? It's not that far away. So, when somebody comes in for their initial breast health session, it's more of an educational session. And so that we kind of go and do a little bit more of a deep dive one-on-one into the lymphatic system and how it works in general, and then how it works specifically in the breast. And, because the breast tissue doesn't have lymph in it, why we need to be moving it and how to move it. There's a very specific direction of lymphatic flow in the breast, where we want to be moving things in the direction that's going to help them clear, not cause further congestion. So we're always moving away from the nipple and, most of the time kind of up the sides and into the axillary area, the armpit, and then up to the collarbones and then kind of down and in. It's kind of that general direction of flow. And, we do have lymph nodes on the sternum and stuff that we can move towards and all as well. But most of the time, that's kind of that direction of flow. But how many of us, because of daily postural things, everything's stuck and restricted, in these front puck attachments and, under our arms. And so then we get this congested, stagnant lymph there. Even if we start just massaging the breast, there's no place for it to go. So I'm teaching some basic self-lymphatic drainage. I'm teaching specific breast massage. And then we'll actually do a visual examination standing in front of a mirror. So we're looking at visually what's going on. Does one breast look larger than the other? Is there, like a drawing in on a nipple or other tissue in the breast when you move it around? That might be a sign that there's something underneath that's kind of adhering that tissue, whether it's a muscle tissue or something we really don't want there. But we want to have that awareness. So, we kind of go through what are we visually looking for? What's normal and not normal in what we're feeling with different types of breast tissue. Most women probably haven't felt a lot of other women's breasts. Right? So
Right.
it's like, am I
You wouldn't
normal?
know. Right. You wouldn't
It's
know.
like, I don't know if I'm normal compared to the rest of the world. What is normal? So that's why, I want to encourage women to know their own breast tissue, how it changes throughout the month, and to get that lymph moving. And if they're doing that kind of work regularly, you're much more likely to pick up at a very early sign of something being wrong. And when we get into the treatment realm, there are a lot of options, but typically the sooner you get working on something, the better the outcome.
Would you, if a woman was diagnosed with breast cancer or had some other breast challenges going on, is that's something that you can support them all the way through, right? You have different modalities of therapies, or just you're someone that they can lean on in that journey?
Yeah, I can definitely be a part of that team. I'm not the only one in that team when we're at that place. And I do and have worked with many women with breast cancer in different ways, based on what's comfortable, based on what their physician's recommending, different things like that too. So, even in a session, sometimes, we'll use full breast metacupping where I have, various sizes of larger breast cups just to really flush out, the lymph and get things moving. There are different light therapies that we use. One of them is called the LymphStar Pro. It's kind of like a manual lymphatic massage. I think they say ×7. That can very quickly, through light and vibrations, help to clear things out. Sometimes, percussion. I mentioned like a vibration plate or that kind of thing, but sometimes we'll do direct percussion to help clear some of the congested lymph. So there's a lot of different things we can pull in, and even some of our standalone therapies, like getting in the sauna, is huge, or some of the light therapy options.
I love that you have all these tools to help support women with their breast health with anything, and men and anybody. You have such an amazing array of things that people can take advantage of. And obviously you're there to guide them through that too, because as much as we want to do all the things, they're not needed necessarily, but you have a lot of different tools that they can use. So I think that this conversation has been really enlightening. I am like, okay, I have some, this is really good. I love it.
I hear a free the girls type movement happening here. Awesome. Well, thank you so much, Dawn, for enlightening us with all of this really, really important information. Dawn does have an event coming up on September 25th. Why don't you tell the listeners a little bit about that? Because that'd be a great place for them to learn more about breast health and the therapies and everything we talked about in this episode.
Yeah, so September 25th, we'll be hosting a Who We Are, What We Do event that just does a little more of a deep dive into all of the therapies we offer. And it also gives you a chance to kind of wander around, see some of these kind of strange sounding things, maybe experience some things a little bit, for yourself, or give you some new ideas of some of the things that are a little bit more out of the box that might benefit you, including in the breast health realm.
And speaking of out of the box, our next episode is going to be talking a lot about the different kinds of tools that you use in your clinic too. So I'm excited to delve into that a little bit.
Out of the box therapy. So
Yes.
Stay tuned for that one. Dawn, what's your website again where people can find you?
SoteriaWellnessLLC.com.
Awesome. Thank you so much for joining us, and we will catch you guys in the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.